Welcome to Bio2401 Video Lab. My name is Professor Alejandro Enriquez. Professor Sturm and I are going to be making videos for your Bio2401 labs for the first week because there is no lab meeting on the first week of classes this semester here at Victoria College. Please, as you follow along with this lab, make sure you have your lab manual already. So it should look like this. This is your Bio2401 and 2402 lab manual. Please note that it does not say core concepts. If you said core concepts, then that would be for 2404. So make sure you have the right one. That's all you need to look for. Please follow along with the video. Make sure you have your lab manual. We're going to be going over exercise 1 in this series of videos so that you'll be prepared when we start lab next week, that you'll have that foundational information. Also, please note that there are blackboard quizzes online for each of these videos so you can test your knowledge and test and make sure that you know how to read the book, and you'll see what material is going to be required on your first exam, because your first lab exam will cover material that I'm covering here in these videos. If you have any questions, of course, you should always contact your lab instructor or your lecture professor and ask, because that's what we're paid to do here. We answer your questions. Alright, so without further ado, I'm going to start in the first video of the Exercise 1 series. The first lesson I'm going to be covering is Exercise 1-1 in your lab manual, the anatomical position. So, the anatomical position is a standard body position that is used by medical professionals all over the world. It's basically, understanding it is important just because that's part of how medical professionals from different parts of the country, even different countries, will communicate with each other. So the anatomical position basically looks like this. As you can see, it's a person standing straight forward, head facing forward. One of the keys is that the palms are turned outwards like this, palms forward. That's the anatomical position right there. What that is a common reference frame for people to describe what body parts are located where. And on its own, it might just seem, okay, all right, that's an anatomical position, whatever, I don't understand why this even matters. Well, the reason it matters is because once you understand that, go ahead and flip to Exercise 1-2, directional terms. So the directional terms are based on the anatomical position, and understanding the directional terms is incredibly important for being able to communicate with your medical profession peers. So a good example of this is, suppose that I'm a surgeon, I have a colleague, we're both surgeons together, and we're going to operate on a patient who's lying on a table, operating table, and I've taken the scalpel and I'm starting to cut into this person, and my partner, my colleague, says, okay, I'm going to need you to cut down about 1 inch. And my partner, maybe he means cutting down like this direction, but I'm thinking like gravity. And so I cut down 1 inch and blood goes everywhere and I get sued, right? That's not what you want. You want to be sure you're using clear, objective language to communicate what you mean and not have any disputes or discussion about what do you mean by down? What do you mean? You mean my left or your left? What are you referring to? You do not use those terms when you're in a medical setting. So feel free to say down or left or whatever, or over there, when you're at home with your friends. But here in the laboratory, when you're working as a pre-medical professional, you are expected to use precise vocabulary to discuss what locations are relative to what. Using the anatomical position is the other important part. So, we're going to go ahead and learn, first of all, when you say up and down, when you're thinking on your body like up and down, we do not say up and down, because as I said, that you could be confused by thinking that's in reference to gravity, which it's not. In the anatomical position, this direction, we call this superior. And going down on your body, this direction is known as inferior. So superior and inferior. Now these are relative terms, which means that you're taking 2 points and you're describing how they are related to each other. So, for example, my head and my chest are related to each other by this direction. So you can say that my head is superior to my chest, right? And that means my chest in turn is inferior to my head. Do you see how there's a reciprocal relationship? Now, your chest might be superior to your belly, your abdomen. And that means your abdomen is inferior to your chest. So these directional terms here are in reference to the anatomical position. right? So if you take a person and turn them upside down, then superior still refers, their head is still superior to their chest, even if you turn them upside down. It's just, you know, they're spatially arranged. You spatially rearrange their body out of the anatomical position by holding them upside down. So that's superior and inferior. And then the other, all right, so the next term we want to cover is going forwards and backwards. Now, we don't say forwards and backwards because forwards and backwards might be ambiguous as well. So when I want to move this direction on my body, what we might think of as forward, we call this anterior. And the opposite direction, going this direction, is posterior. So anterior and posterior are ways to describe points that one's in front of the other, basically. So for example, this is my sternum, this is your breastbone right here. This is anterior to what? That's a good question. What's this anterior to? This should be anterior to a lot of things. It should be anterior to your heart, and your lungs, and your spine, and your spinal cord, right, and your esophagus. Those are anterior to those structures. So my spinal cord, for example, is posterior to my sternum, right, to your breastbone. So keep in mind that going forward and backwards, same thing, right? Your belly button, your navel, is anterior to your intestines, and your intestines are posterior to your navel, right? So this is basic reciprocal relationships we're seeing here. One thing I want to mention now is that there are synonyms for these terms. You'll see sometimes they're in your lab manual. You will not see them used frequently, but you should recognize them. So veterinarians often, in addition to saying anterior, posterior, superior, inferior, they also have other terms. Towards the head is cephalic, right? Like cephalopod, right? Like you know, hydrocephaly. Cephalos refers to your head, so cephalic means towards your head, and caudal means towards the tail. We don't really have a tail, but you know, that direction. And that's synonymous with superior and inferior in humans. And then this direction, anterior, is also known as ventral, towards the belly. And this direction is known as dorsal, towards the back. Right? You may have heard of a dorsal fin, right? Dorsal fin on a shark or a dolphin, so forth. Now, veterinarians use those terms because on different animals, it's not always the same thing. Anterior means towards the direction you're walking, which in us humans is the same as ventral. But if you look at a dog's ventral direction is down. That's the same as inferior. And its forward walking motion, or anterior, is the same as its head movement, so where its head is, so that's cephalic. So in a lot of animals, caudal and cephalic and dorsal and ventral are arranged differently than they are in humans. We won't be emphasizing those much, but you will occasionally see those terms used, like, for example, the dorsal root ganglion is another name for the posterior root ganglion. You should know that dorsal and posterior in humans mean the exact same thing. So that's just one thing to keep in mind as you're learning this material. So primarily we're going to be using superior, inferior, anterior, posterior, right? Okay, so the next thing I want to talk about is the fact that, now, take a look at my ears. You'll note that my ears are posterior to my eyes. But if you look in this direction, if you look at me right now, my ears are not directly posterior to my eyes. My brain is. You want to go right back behind your eyes. That's where your optic nerve and your brain is. You also, in order to reach your ears, you have to not only go backwards, but you also have to go out to the side. Right? So that would be a term for that, is lateral towards the side. And then coming towards the middle would be medial. So my ears, what are my ears lateral to? They should be lateral to my brain, right? Because they're on either side of my brain. If you want to get to the eyes, my ears are lateral and they are posterior to my eyes. So make sure that you understand that if I look and say, okay, so here's my belly button and here's my shoulder, your navel is not just inferior to your shoulder. Look at this. If you go straight up, you don't hit your shoulder. You hit your chin, that's fine, your neck. But in order to go from your navel to your shoulder is superior and it is lateral to your navel. Your navel is inferior and it is medial to your shoulder, right? So make sure you keep in mind that we're going in straight lines here. We're going straight up and down, straight left to right, right? Straight across, and then straight forward and back. So that's why we'll have medial and lateral, and at the same time we might say, all right, it's superior and it's medial, and so forth, right, at the same time. So, so keep that in mind, right? Don't get sloppy and think that just because it's above that means it's superior. Well, sure, it's superior, but that's not its location. If I'm trying to be exact, now here's the thing. If I'm a doctor, and I'm talking to another doctor, and I'm saying, we have to remove this tumor. Where is the tumor? You need to be precise. You cannot just say, the tumor is 2 inches superior to the kidney. Unless that's exactly where it is. If it's superior, and it's a little bit medial, and it's a little bit posterior, you need to say all those words. And so that precision of being able to describe exactly where something is relative to something else is a key skill that all medical professionals must share. And so that's one thing about being in a class like this. People often come in and say, why do I need to learn all this material? I'm going to learn it again when I'm on the job. That's true. That's fair. That is true. But they are going to want to see that you have the meticulous nature to be able to use this exact language. I don't want a nurse or a doctor taking care of me who's sloppy. Because this is, make a mistake and, you know what, that's going to be, whoops, I don't have an arm anymore. Too bad, jeez, right? I'll just have to figure out how to use chopsticks with my other hand somehow, right? So that's something that matters. This class emphasizes not just the content, not just the facts, but also the skills and the precision that you're going to be asked to use. Okay, so we've got superior and inferior, we've got anterior, posterior, we've got medial and lateral. Now, those are our 3 dimensions of 3 axes of movement. Now, we have 2 more directional terms we like to use. One of them is related to the fact that if you look at the anatomical position, let's look at the anatomical position again. Take a look. How do I describe where my elbow is to my wrist? Now, you can say, all right, your elbow is superior, but it's not just superior. It's also medial at the same time, and maybe it's also even a little bit and posterior or something. So this is not a good recipe for success. So we want to have to say, we know what you mean when you say elbow versus wrist. So we use other terms. We use these terms proximal and distal to refer to when 2 points that I'm comparing are on a limb. Now this doesn't work. You don't use proximal and distal for your torso. It does not work. You don't say your heart's proximal to anything or distal anything. It doesn't matter. But you do say that your elbow is closer to the attachment point of your limb than your wrist, which means that your elbow is proximal to your wrist, and that means that your wrist is distal to your elbow. Now, this can be very confusing for people sometimes. This is historically one of the most challenging of the directional terms, and the reason for that is because you have to say, all right, my elbow is compared to my shoulder, and then my wrist is compared to my shoulder. And you have to include your shoulder or the attachment point in this calculation, and people get confused. And so, all right, I'm comparing my elbow to my wrist. All right, my elbow and my shoulder. All right, my shoulder's closer, so my shoulder's proximal. I wasn't talking about the shoulder. I'm comparing elbow and wrist. Do you see that as a mistake it's easy to make when you're first learning this calculation? You have to say, all right, I'm comparing the distance, this distance, and this distance. Which one is a shorter distance? That one's proximal. Being able to make that calculation to understand how you're comparing these 3 different parts, that's, again, part of that meticulous nature you have to develop in order to be a trustworthy medical professional. This works as well for all limbs, so that works for your arms. I don't really ever see it for the head, but you do see it for the legs a lot. So here's a question for you. How do I relate my knee and my ankle? How do I relate those? Think about that for a second. Knee, ankle. So your knee is closer to your hip, which means your knee is proximal to your ankle. Your ankle, therefore, is distal to your knee. You should be able to make that calculation, right? So that is a comparison you need to be able to make on any limb. So that would be arms and your legs and anything else that might happen to be dangling off of your body. All right, so the last directional term is superficial and deep. Superficial means towards the outside of your body. Deep means towards the center of towards the inside of your body. So here's a question. What is the most superficial of your organs? Superficial, most outside. It should be your skin. Your skin is, that's correct, your skin is the most superficial of your organs. So your skin is superficial to your muscles. right? Which means your muscles are deep to your skin. But then there might be another organ that's deep to your muscles, like your bones, for example. So your bones would be the most deep, your skin would be the most superficial. Your muscles are intermediate. Your muscles are deep to your skin, but they're superficial to your bones. So that should hopefully make sense. You should see, and we do often see superficial and deep used, for example, when we talk about layers of the skin. It doesn't make sense to say inferior, superior, or anything like that, because your skin goes all the way around here. Right? It's all around the outside. The most superficial layer of your skin will be the epidermis and so forth from there. Okay. So those are 9 directional terms, right? Superior, inferior, anterior, posterior, medial, lateral, and then we have proximal, distal, and superficial, deep. So those are the terms you should be able to use in order to compare 2 different points. You should be able to take 2 points on your body or 2 body parts and compare them. Right? You should be able to say, all right, well, let's see. Here's my hip. All right, my hip is going to be superior to my knee, and it's going to, or you could also say it's proximal to your knee as well. Your hip is inferior to your shoulder. Your hip is medial, or excuse me, it's not medial to anything, right? Medial to your whatever you got out here, right? Your hip should be lateral to your pubic region, etc. Right? So you should be able to make all of these relative comparisons. That's just something important. That's an important skill set you should be able to develop. The last thing I want to emphasize is, I already said this, but people will forget it. These are only in the anatomical position that these are considered valid. So for example, if I take my hand and put it in the air, this does not mean all of a sudden that my elbow is superior to my shoulder. That is not true. Right? And watch out, because I'll fool you. Every semester, I fool people. Take a model with an arm like this and put it out, and I'll say, compare these 2 points. People will try and do superior and inferior. That is not valid. On a limb, I should be using proximal and distal, even if the arm is pointed out to the side. Right? I can't just change it and say medial and lateral now just because I've rearranged the orientation of the limb. Right? So make sure you're on top of that. This anatomical position is what these are valid in, and that's why exercise 1-1, the anatomical position, is important, because without it, exercise 1-2 becomes just more confusing instead of more clear. Exercise 1-3 is the last part of the lab manual that I'm going to be covering in this video. Exercise 1-3 is about your anatomical regional terms. So again, just like with the anatomical position being a standard, these regional terms are standardized for all positions all over the world who use. Even if they don't speak English, they still use versions of these exact same words. So I'm going to need you to take a look at it. Go open up your lab manual and take a look. In exercise 1-3, there's a list of 39 of these terms. You are expected to know all of these terms. Now I want to mention, though, that's not nearly as tall an order as it first seems at first glance, because a lot of these terms should already be familiar to you in some way or another. Umbilical, your umbilical cord, right? Yes, exactly, right? We know what that is. Yeah. Optic, what do you think that's referring to? That's referring to your eye. Nasal, what does nasal refer to? This should be your nose. Everyone should know nasal refers to the adjective referring to your nose. So a lot of these terms should be familiar to you already. Now, there are some that maybe you may have heard before, possibly depending on how big your vocabulary is. Brachiate refers to using your arms, so this is your brachial region, right? So there's some that are a little stretched. Maybe the muscles for your rear end are called the gluteal muscles, or gluteus maximus, etc. So the gluteal region refers to your rear end, right? And so there's only a few of these necessarily that are going to be completely unfamiliar or be deceptive. So antecubital, you're just going to have to learn that. That's the front of your elbow. Popliteal refers to the back of your knee. The front of your knee is patellar, right, like your patella, your kneecap. The back of your knee is popliteal. Crural and sural. Inguinal is referring to your groin region. I also want to mention that some of these regions are larger and contain other smaller regions. So for example, your thoracic region is your whole chest region. It contains within it other regions, like, for example, your sternal region, your mammary region. Those are regions within the thoracic region. So, there's only a few. The otic is referring in reference to your ear. Mental is one that confuses people because you think it has something to do with your thinking. But actually, your mental region is actually your chin. Right? And so there's actually little tiny nerve holes here called the mental foramen. the nerves come through. So make sure you know, once you learn these words, a lot of other words are going to come more easily. Femoral refers to your thigh because the bone there is called your femur. Acromial refers to the top of your shoulder because that is where the acromion is located, which is, a part of your shoulder blade, your scapula. So make sure you learn all of these words. Now, a lot of them should be familiar, so you're not going to have to memorize 39 new words. You're going to have to learn some new words. That precision, again, that diligence, being able to pick up new terms and apply them is a big part of why you're in an anatomy and physiology course. So, make sure you take the Blackboard quizzes for all of these lessons, and make sure you're on top of all of that material. That's the end of this video, but there's another video that's going to be by Professor Stern. So make sure you watch that one as well and take the quiz for that as well. And then we'll see you in lab soon. Thank you.